The simple answer to that is certainly not all of them. One of the treatments that the president is receiving is still considered experimental. In fact, it's been tested on fewer than 300 people in the world. Another has serious potential side effects. Tiger Stockbridge from Natick says he's never been a political fan of President Trump, but when he heard the president caught the coronavirus, he felt sympathy for him.
I know what the family was going through, possibly what he was going through.
That's because Stockbridge had COVID-19 last spring. So did his brother, who was hospitalized, and his mother, who died. Now the president is receiving some treatments that were not yet available when Stockbridge's family became sick, and at least one that's still not available to the public.
I mean, I know how the world works, and I understand it. Am I upset and angry about it? No, I'm not upset and angry about it.
What bothers Stockbridge more is what the president said about the disease after he was released from the hospital.
Don't let it dominate you. Don't be afraid of it.
I get it, but it's an irresponsible comment for the President of the United States to make.
In another message, which Twitter labeled as misleading and potentially harmful, the president wrote COVID is, for most populations, far less lethal than the flu.
We don't know how many people in the country have flu every year, and we don't actually know how many people have COVID.
Because of that, Dr. Shira Doron of Tufts Medical Center says it's nearly statistically impossible to compare death rates, but anecdotally, she has a pretty good idea which disease is worse.
Even a pandemic flu season like the 2009 H1N1, we didn't see refrigerated trucks needing to come to hospitals to take bodies away. Now, the president says now that he's had COVID, he thinks he might be immune. Dr. Doron says there have been a handful of documented cases across the world of people becoming reinfected by another strain. Still, under CDC guidelines, if the president is exposed again within the next 3 months, he won't have to quarantine again. Live in Natick, David Bieniek, WCVB News Center 5.